Hi, welcome to my channel, Rohit Speaks. And in today's video, I'm going to extend on my cancer series and talk about the current therapies which is ongoing in cancers. And there are two which are majorly being used. One is the regular chemotherapy, and the other one is immunotherapy. So I'm going to talk a little bit in details about what this is exactly and what's going on in there. So what is chemotherapy? So chemotherapy is nothing but you have like a cocktail of different chemicals which is injected you through the IV, basically through your veins. And so basically the idea here is to kill this rapidly dividing cells. So in your when you have your cancers, these are your normal cells growing at a normal speed, but then your cancer cells are going at a various high speed. So what this does is basically it will stop dividing the cells. Now that will also affect your non-cancer cells as well. That's why any system in your body which requires your cells to divide, even though after you're an adult, it will also stop that division. So what will happen is wherever you have cancers, they will start dying, but also the other cells which are wanted for normal function will not divide for that period of time when you're injecting with chemicals. So hence the hair is lost because hair cells, your skin cells, they rapidly undergo division. They are always there developing something new. So that's why you lose your hair follicles. Your skin creates some kind of it will not get developed that faster. Your gut internal, your mouth, all these cells they are normally divide every day. Every day they go undergo division and they develop new cells. But when you're doing this chemotherapy, those cells will not divide as well. And also now your cancer cells will start going down. So your doctor will rapidly check or will keep an eye on your tumors. And if it goes down, then they will stop your chemotherapy. But that's what happens when you take chemotherapy. It will basically stop the cells to divide. Even your whatever is rapidly dividing, which are your cancer cells and your non-cancer cells, everything will stop. So once the cancer cells are brought back down, there is no more cancer cells or no more division happening, then they stop the chemotherapy. So it takes a while, but it does the job. The next, what happens is, as I said, it has a mixture of alkylating agents and antimetabolites. So what they do is basically they go insert inside your DNA and doesn't allow those signals which allows your cells to divide to not happen. Basically, it will stop those signals and your whole body, across your whole body, it will not happen. Another side effect is also you will be immunocompromised. So if you have any other infection while you're undergoing chemotherapy, you will get that. So for example, if you catch a cold and a flu, it will not go away since your body is not being able to produce new cells while you're undergoing chemotherapy. So those are a couple of side effects, but overall, you will get down the tumor to a normal level. And then the next one is immunotherapy. Now, this is actually using your own body's defense mechanism and reprogramming it to attack tumor cells. But for this, there need to be a lot of backup, a lot of thought process. So suppose this is your tumor cells. There's a lot of different microenvironments in it. So scientists have been studying what can be targeted for each different cancers, lung cancer, cell cancers, your osteomas, your carcinomas, or your sarcomas. People have been studying that to find different microenvironments which people can target. So your antibodies, for example, right here, one arm will have which will target your something something which is unique in your tumor cell, and the other arm will bring your natural killer cells. Those are the ones which will kill this body of tumor. So basically, you will have two-prong approach. One will bind to your tumor, and other one will bring the natural killer cells, and then it will kill your tumors. Same way, cytokine. Cytokine is it's a messenger. Basically, it will stick to this, so they will find something in the tumor, and the cytokines will stick to the tumor, and then it will give the signal, "Hey, I am here. Come, attack this thing," and that will happen. Same is with CAR T cells, viruses to use this as their cell host, and then they will disturb and kill it. Vaccines are basically monoclonal antibodies, which is specifically designed to kill this. So there are different approaches in immunotherapy. The only issue with immunotherapy is it takes a while for it to clear out the tumor cells. while chemotherapy is going on, it might show effect in a couple of sessions, but immunotherapy takes a while, but you're not injecting a bunch of different chemicals and uh, going through all that. So there are two approaches: chemotherapy, immunotherapy. It can be taken in different stages of your cancer. Immunotherapy, if you start in stage 2, it will be much more beneficial. Chemotherapy can be done either in stage 3 or advanced. So it's all dependent on how you want to look it up in cancer therapy. But these are the new age of medicines, and people have been, or biotech companies and pharma are working on creating new therapies for different and specific um, cancer. So always keep an eye out for these companies, and they will tell you this is for this particular gene or this particular tumor. And then once you know these clinical trials are going on, there is hope that there will be some kind of vaccine or some kind of antibodies which can be used to treat these tumors. In the next video, I just want to show you, this is one of the antibody effect. So these are the T cells, these are your immune cells in your body, and these are your cancer cells. So these are grown in a plate actually. So just to show you, these T cells now can attack the cells and kill them off. And that's how they get rid of it. So this is a really cool video just to show how they can attack and kill your tumor cells. So there is hope. It's just, I feel cancer therapy will be much more tailored, which will be depending on subject to subject. If there is a big population of the same cancer, there will be one genetic medicine or one vaccine or one antibody. But if you have some kind of a different cancerous tumor, subjects would, what would happen is basically you will be biopsied. There is a way to do all kind of metabolome proteomics on it to find that specific signature of that tumor. Once they find it, they can tailor an antibody or a medicine to target that. It might be expensive depending on how it is, but there is hope to get rid of the cancers. So thank you for tuning in for this video, and I'll follow up with the reasons on how to safeguard yourself against cancers, what are the common reagents or common causes for cancers, and what to watch out for in the next one. Okay, see you. Bye.